with this technique of removing crowns. We'll talk about them later. And this is part of one of my lecture series of how did I practice dentistry before I had lasers. I have no idea how I practiced without lasers. I'm a laser dentist. I practice in Severna Park, Maryland. One day I was at lunch and I was waiting for my afternoon patients to come in, and I looked over my schedule and I saw a new patient was coming in. My front desk person, Lloyd, had written me a note that said, new patient, uncomfortable crown, crown made in Japan, wants crown removed and replaced. That's a lot of information for me to put on my schedule, but that's what I do. I do remove crowns. I look at my operator, and there's my assistant, Tammy, bringing back a new patient. About a 40-year-old male, and they're sitting in the chair, and he pulls out a laptop, PowerPoint on his laptop, and he's showing pictures to my dental assistant of his teeth. He said last time he had some extra time, so he wrote up this PowerPoint showing what his tooth looked like before he had his crown on it and how it looks now with this crown that's on it. He said the crown was put on about 3 weeks ago, and since it put on, all hell's broke loose. It feels like it's too low. It hurts when I bite on it. Hurts all the time. I want this crown out of there. He said he talked to his dad. He said the only way to take this crown off is to cut it off. He said if he cuts it off, it's going to create heat. It might kill the tooth, and your tooth might need a root canal. He says, I don't want a root canal on my tooth. He tells me this crown is made out of zirconium. He knows what the crown's made of. This crown is made of some sort of Swiss zirconium. He knew what it was. He said, I want it off, and I want something different put on. So I said, okay. His name was Bailey. I said, well, let's check it out for you, Bailey. Let me get a picture of your tooth. Let me get an x-ray and see what's going on. So I took a picture of Bailey's tooth, and here it is up on the screen right now. It's a solid zirconium crown on number 15. Tooth next to it on 14 has an old amalgam, probably some caries there. But most of the sensitivity is cold and unbiting, so I think it's more from the crown. You can see the crown is very over-contoured. There's some bite paper on there, and you can see that it's just really whacking when he bites on it. I took an x-ray of his tooth, and it looks like a good fitting crown, but there's a big chunk of cement between the second molar and the wisdom tooth. That's probably what most of his pain is. He's getting pain because the tooth wasn't properly cleaned, and he has occlusal trauma on the tooth. I go, Bailey, what I can do, I can use my laser. I can take off this crown for you, clean out the cement. I'll take my another laser. I have an Nd:YAG laser. I'm going to run it around the edges, and it'll get rid of most of your pains. Nd:YAGs are great for anything that's red, anything that's inflamed, anything that's infected, anything that hurts. Run Nd:YAG laser around it and make the gums feel better for you. I'll do that to trough it up for you so you can make it nice and clean. I'll adjust the bite, get rid of that traumatic occlusion for you, put your crown back on, clean all the cement out, and you'll be ready to go. At the same time while you're there, I'm going to take out that old amalgam on the tooth in front, get rid of the caries there. I think you're ready to go. Because I don't want that. I want something else. I don't want one of these ceramic crowns. I want something that any dentist could take off. I said, okay, let me think about that. I said, how about, okay, we can take it off for you. But once I take it off, we can take impressions. I can make a new crown for you. I can make a crown that's solid metal. We can make a full cast crown. That way we can take away as little existing tooth structure as we can. But this crown is so over-contoured, it needs to be prepared, re-prepared for you. I can use the same crown as a temporary. Once I take it off, I'll be able to adjust the bite for you. We'll put the same crown back on you, but you have to come back in a couple weeks. His address that he had put on was Alexandria, Virginia, which is about an hour and a half from my office. And I'd say, well, the only trouble with that, you're going to have to come back. I can't do it today. You have to take the impression today. We'll temporize it with your existing crown. You're going to have to come back in a couple weeks. Because that's fine. I want to spend some time with my mother anyway. I saw that he'd come with an older woman. It turns out his mother had just picked him up at Dulles Airport, which is in Virginia also. It's about an hour and a half away from my office also. It turns out he had time to do his PowerPoint last night because he took a flight from Tokyo, Japan to Dulles Airport, 12-hour flight. And then his mother drove him an hour and a half to my office just to have this crown removed. He decided that he did not want his crown removed by having a cutoff, so he went on the Internet. The Internet, he found one of my articles from Dentistry Today from June 2013, which was removing ceramic crowns with a laser. He said, That's what I want. He went onto my website, saw testimonials from other patients, read everything that I do in my website, called up, made an appointment, and flew 12 hours in an airplane to come to my office in Severna Park to have his crown removed. Now, this is putting a little pressure on me now. I have to remove a crown, which I don't know what it's made of. I don't know what kind of cement was put on with. I don't know what's underneath this crown. But I'm the laser dentist. That's what I do. Got myself in this situation because I have information on the website and on the internet. So this is what I do. I'm going to take off his crown. So I numbed him up real well. 2 minutes later, pop, crown comes off in one piece. There's his tooth there with his crown. See, it's an over-contoured prep, so all the cement pretty much is still on the tooth. I'll remove that when I prepare the tooth. I'll take my Nd:YAG laser and go around. You can see what's all bleeding on the distal layer where that cement's been wedged in there. We'll trough it with the Nd:YAG to stop the bleeding. I'll take a nice impression. Then we'll put his existing crown back on as a temporary. So I said, Dale, you have to come back in 2 weeks. Let me make you an appointment. Get your teeth cleaned. We'll put your crown in and make sure everything's doing good so before you go back to Japan. And also the tooth in front, the first molar, I'm going to take out the amalgam there on caries and build that up for him also. So there's the crown when I took it off. Like, so when I take these crowns off, they come off in one piece. There's no sparking. There's no burning. There's doing no damage to the crown at all. The crown's coming off in one piece, so I'm able to use it as a temporary, or in some cases, I'll show some cases today where we put the crown right back on as a permanent crown again. Before we put these on, we're going to do a little air abrasion on the inside, do some little sandblasting and clean the inside of the crown before we cement them back in. So I pre-prepared his tooth for him, lasered around the edges, took an impression. Everything looks good. Did the filling on the tooth in front, did a little build up on that tooth, put his temporary on, and Bailey's back on the road. So he's going to go visit his mother down in Alexandria, Virginia. I call him 2 days later, how you doing, Bailey? He goes, still doesn't feel good. I'm still having pain, still doesn't feel like it fits right. I go, well, that's your reward for coming back. When you come back, we're going to get you a crown that's going to feel wonderful for you. But let me see if I can get the lab to get this done a little quicker. So I talked to the lab and said, Bailey, come on in 3 days. I'll have your new crown for you. Comes back in 3 days. Still wondering if this is going to be the answer. But he's coming back. This is what Bailey had to say. To have the poorly made crown removed, I decided to travel halfway around the world for lasers to prevent damage to the underlying tooth, and therefore to avoid a root canal. The lasers lived up to their promise, popping out the crown in less than 2 minutes. Pretty good testimonial from Bailey. Now I've got to make his tooth feel better, make him happy here. He comes back 3 days later, and here's his new crown. It's a solid gold cast crown, nicely contoured. I got the bite nicely on it. A little inflamed from where that over-contoured zirconium crown was. But it's in there. He's happy. I said, Bailey, I'll see you next week. We'll clean your teeth. We'll make sure everything's perfect for you. We'll adjust the bite if we need to. 2 days later, he calls me and says, Doc, tooth feels great. Too far to go to get my teeth cleaned. I'm not driving an hour and a half to get my teeth cleaned. So it was all right for him to go halfway around the world to get his crown removed. You know, it was important to him, but not to get his teeth cleaned. Just say, hey, things like this happen. You know, it might be one time in my life that someone's going to call me to remove a crown. There's Bailey before, and there he is after when he left. 3 weeks later, guess who comes walking in the door again? Another note. New patient, uncomfortable crowns, wants his crowns removed. This is another patient who gives me an address of Virginia. This is William. William has 20 Emax crowns and veneers in his mouth. He said he's been having pain on his lower anterior one since the dentist put him in. The dentist just cut out the one on tooth number 25. It was the most painful experience he's ever had in his life. He said it was worse cutting out the one crown than it was preparing all the other 20 teeth when he had all this cosmetic dental work done. He said it still hurts. The dentist remade that one crown, put in with a permanent cement but didn't bond it. Now the one next to it's hurting. So I said, okay, let me check this out. So again, I put some bite paper in, and guess what? Tooth on number 26 is in traumatic occlusion. Every time he bites, that's what hits first. The gums around these teeth look like hamburger. There's a retained cement everywhere. So I take an X-ray. Here's another picture of the lingual. It's sort of like 3/4 crowns, very thin on the lingual. Are you going to take these out with a laser? Sure, that's what I do. So we take an X-ray, everything looks good on the X-ray. The same sort of thing. William, what I'm going to do is I'm going to numb you up. We're going to take off both of these crowns. We're going with an Nd:YAG laser. We're going to clean the gum up and get rid of all that inflammation. It's red, it's inflamed, it hurts. We're going to get rid of the pain with my Nd:YAG laser. These crowns are going to be taken off. We're going to clean all the cement off. We're going to trough around it so there's no bleeding. We're going to adjust the bite, and we're going to put your 2 crowns back on, and we're going to bond them on with permanent cement. Why do we want to put them on with permanent cement and bond them instead of just putting them on with temporary cement? If something's wrong, I can always take them off again anyway, so what's the difference? Let's put them on with permanent cement, send them back to Virginia. So 2 minutes later, pop off his crowns. You can see there's 2 teeth here. Let me go to a little pointer here. This was the one that was on with just regular cement. It wasn't bonded. You can see there's no cement at all on that tooth. When I lasered it, the laser sort of picks the easiest place to come off between the cement and crown margin. In this case, the weakest link was between the tooth and the cement. On the tooth here, all the bonded cement is still there. There, the weakest link was between the Emax and the cement. We'll go through this as we show some cases how sometimes the cement stays inside the crown, sometimes it stays on the tooth. Doesn't make any difference. As long as it comes off in one piece, we're happy. But you can see all the inflammation around these teeth. We're going to laser this, get rid of all that inflammation, reshape this a little bit, trough it so there's no bleeding. And when that's done, we'll put his crowns back on. We'll adjust the bite before we do that and polish them up. And then I'll clean all the cement around all his other crowns that's lousy and send them back on the road here. So there's the crown. So it came off in one piece. This was the one that was bonded on. You can see there's no cement in there. There's a little bit of a chipping on the lingual area where that real thin margin was. I cleaned that out with some air abrasion and also took out the chip where they will probably use a little bit of bonding there on the lingual just to smooth it out when we're done. But it came out in one piece. We're going to put this crown back on, his other crown back on, and send him on the road here. So we lasered it, cleaned it up, troughed it, re-cemented his crowns. Crowns are back in. This is immediately after we did it. You can see where it's been lasered there. That gum will all heal up and look nice in a day or two. The lingual here, I got all its cement out. Where I chipped there a little bit, we smoothed it up a little bit of bonding. Everything looks good. I cleaned all the cement out. William's ready to go. For testimonial, William said, as a patient who knows what it's like to have crowns physically cut out, Dr. Krantz's laser alternative struck me as nothing short of a miracle. Nice testimonial from William. And he drove about an hour and a half, 2 hours to get to my office. And that was the only time I saw him. I called him 3 days later. How you doing? He said, everything feels wonderful. That was the answer. He's very happy, but he says if anything ever happens with his crowns and needs some more work and needs a crown removed, he knows where to go. This is me, family laser dentistry. There's me using an older RVM sort of little photo shoot on my mask on. I'm sort of showing off what it would look like to use a laser for someone. My office is in Severna Park, Maryland. I've been practicing there for 35 years in the general area of the peninsula, just outside of Annapolis in Maryland. Disclosure today, I'm a full-time dentist. I do not have any ownership or have any interest in any laser companies. I do teach, and I am a certified trainer for the Institute of Advanced Laser Dentistry. I get paid by Millennium Dentistry for speaking, and tonight I will be compensated for this webinar by Fotona. Okay, I started doing lasers. 1999, that's a long time ago. I used to have a periodontist who worked for me in my office. And he did all my cases for me. He came in and he'd do my grass. He would do my osseous. He'd do all my perio cases. He'd come in about twice a month. Well, what happened was, he was only there twice a month, guess who ended up doing all the post-ops and taking out the sutures and listening to the patients complaining how much their mouth hurts after this periodontal surgery? Me. So when lasers started coming about, and I was doing some work for a company, and they said, hey, I got something new coming. You have to try it. We came out with a technique using lasers to do periodontal surgery. It was a pulsed Nd:YAG laser. Made sense. I started doing periodontal surgery. It worked out so well, I was able to get rid of the periodontist, do my own perio, and I had a lot less complaints from the patients. Now that I have this laser, I'm doing my own peri-out. I was able to pay for the laser very quickly. And what else can you do with this laser now that I had it? I'm kind of cheap. I like using lasers for other things. All of a sudden now I'm doing frenectomies. I'm doing gingivectomies. For all my cosmetic dental work, I'm able to do contouring and gingivoplasty. I'm able to treat infections, incisions, excisions, doing all kinds of things that I was letting the periodontists do or I was sending out to the oral surgeons. All my cases, I'm troughing, like I showed you on these cases today. I do tissue retraction and troughing. Like on that case for Bailey, I don't pack cord. I haven't packed cord in 15 years. I use my laser to trough. No bleeding, get nice impressions for it. Soft tissue crown lengthening. If I want to make the length of the tooth a little bit longer, I'm able to remove tissue, no weight. I can take the impression that day, the tissue doesn't change. After I cut tissue with a laser, it stays right where it is. I'm able to do veneers, cosmetic work, same day that I change the tissue. The same with bridge work. Also have this laser now, and I'm using it to stop bleeding when I'm doing my gum treatments. But what happens if I extract teeth? Well, I'll develop a technique where when I extract a tooth, I'm able to get a blood clot. Then I'm able to get a thermal clot by putting the laser in. Like I said, this laser is a nice laser, a lot of these lasers we have, that I'm able to vary the pulse width. So by using a very wide pulse width, I'm able to get enough heat to stop the bleeding without no coagulation. I'm not killing any tissue. I'm just warming the tissue up enough with a laser that it completely sets in a stable clot within 4 minutes. I don't take patients off their Coumadin. I don't take them off their Plavix. I can work on hemophiliacs. Patients, within 4 minutes, are not bleeding anymore. I don't get calls at night anymore. No one's calling me that they're bleeding that evening. And a week later, I don't get any calls for dry sockets either because my clot stays in place. Is this a reason to buy a laser? Maybe not, but that's a nice thing to have. And this is in the laser we're talking about today in our Lightwalker AT. We're having both lasers, Nd:YAG and erbium in this laser. So what else am I doing? I'm doing biopsies. I'm destroying lesions like hemangiomas, mucoceles. I'm able to bacterial decontamination like we did on that case for William. And after endo, if we're having some trouble with some failure, some apicosa, this is a great thing to be able to incise and train those areas up for you. Patients come in pain, can treat aphthous ulcers, herpetic ulcers, can desensitize teeth. And for bleaching, it is a nice heat source, mainly if you want to do a one tooth, like has a root canal and it's kind of dark, fill it with some bleaching material, heat it up, a nice way to get a nice white tooth. Then my patients are going, hey, you have a soft tissue. You claim that you're a laser dentist. Why aren't you using a laser to cut teeth? Why aren't you doing your fillings with it? Why are you still using drills? So the patients are right as always. So I had to go out and buy an erbium laser. So now I have an erbium laser and an Nd:YAG laser. And with the erbium laser, I'm doing caries removal, doing my cavity preps. And with that laser, and actually my new laser that I have now, I'm able to remove all ceramic restorations. And that's what we're going to talk about today. This is my first laser. It's an Nd:YAG. It's a pulse laser. The good thing about pulses, I'm able to vary the pulses, so I'm getting very, very high peak powers. These peak powers penetrate, able to kill bacteria when doing gum surgery, and also we're going to use the same theory when we're using erbiums with high peak powers to break down the water in the seals to break these crowns off. But that's something very important is pulse lasers are what we're doing for these. This is my first laser in 1999. This is a laser that we're going to talk about today. This is a Fotona product. It's a power laser. It's one I've been using 5 years. I'll show you some pictures later, some of the newer versions of it. Basically, there's two lasers in one box. The one on the right there is an Nd:YAG laser, and the one on the right on the top there that has an articulated arm and mirrors, that is an erbium laser. The erbium laser is what we're going to use to remove crowns. Nd:YAG laser is what we're going to use for soft tissue, and we'll sort of describe why we use different lasers for different things. There's no Swiss Army knife. Not one laser does everything. You need different lasers for different things. The idea of a laser came from Albert Einstein. He never invented a laser, but he gave us the ideas back in the 20s of how to make a laser. That's what laser stands for, light amplification by stimulated emission of radiation. So what is a laser? Basically, it's a light source. The light's coming down through the laser at the speed of light. It's hitting some tissue or hitting a crown or whatever dental materials, whatever we're aiming it at, and it can do many things. can reflect off that tissue. If it reflects, it doesn't do much of anything. It can go right through the tissue, doesn't do much of anything. It can go through and scatter all over the place, doesn't do much of anything. What we need is it to be absorbed. When the laser light is absorbed by whatever we're aiming it for, that is where we're going to get interaction. That's where we are going to get what we want to have done with our laser. This is a pretty simple graph here. This basically shows the four major types of lasers. We have diode lasers, Nd:YAG lasers, erbium lasers, and CO2 lasers. And what they do is they're absorbed by different things. We see the diode and the Nd:YAG are absorbed mainly by blood and dark things, where they go right through water. So in that case, it's great to work on soft tissue. It goes in the blood, stops bleeding, cuts gingival tissue, wonderful. But if you try to shine it through water, it goes right through water, no effect at all. Well, teeth are pretty much made out of water and hydroxyapatite. So we need something that's absorbed in water and hydroxyapatite, and that's where the erbium comes in. And also we find out that cement that we're using to cement in crowns has a high water content. So maybe that might be important that we're using an erbium. If we use diode or Nd:YAG, it had no effect on the water. So here we're talking about erbiums, how they affect water. This is one of two handpieces that comes with my Fotona power laser. And this looks like blood, but that's not even actually the laser light. That is just a aiming beam laser to show where we're firing. This handpiece fires about 7 millimeters from where it comes out of the head there. That's where the focal point is. So the actual area where it's hitting on the tooth, that's where it's cutting, about 7 millimeters away from the head of the handpiece. Also, this comes with another handpiece. This is R14. This one actually shoots out of a fiber, a sapphire or quartz fiber. Now this one, the focal point is almost right at the end of the fiber, about 0.8 to 1 millimeter at the end of the fiber. And this one, to me, makes a lot more sense if we're trying to take off crowns, because I know exactly where that power is coming out. So this is something I'm going to be using a lot. It's this R14 handpiece. So how did we develop this technique of how to remove ceramic restorations using lasers? Now when you buy a laser, the first thing you do is you have to take classes. If you're going to use something like this, you want to learn how to use it. So the first thing I did is I went and took some classes. When I took the classes, I'm learning how to do preparations, and this is not my first erbium laser, so I've been using erbium lasers for over 5 years. I always take the class with a new laser, learn how to use it. And my instructor there was showing how you could remove veneers using an erbium laser. I said, that sounds like a good idea. I've cut off veneers before. They're not much fun. If I can use my laser, that's wonderful. So he would use that R02 one 7 millimeters away, and he'd shine it through, and there'd be sparks, and there'd be cracking, and the veneer would break off. But whoever thought you could use a veneer over again anyway, so that was fine. But there was a way now. I had some way to remove veneers. This is Will Rogers said there are 3 kinds of men. The one who learns by reading, the few who learn by observation, the rest of them have to pee on the electric fence for themselves. I guess I'm one that has to pee on the electric fence, so if I can take off veneers, what else can I do with this erbium laser? So here's my Fotona power laser. Like I said, we're going to use 2 things on this. We're going to use the erbium for crowns and the Nd:YAG for other things. Here's my handpiece I'm going to use. Like I said, it's a ceramic fiber. We're going to put that right on the crown, and it's going to pop off the crown in one piece. Why am I going to use a laser? Why am I going to use a dental drill? Well, I took a class a couple of years ago from Gordon Christensen. He was talking about, should we use Bruxer crowns, solid zirconium crowns, should we do ceramic crowns? And his idea was, yeah, this stuff is pretty much ceramic steel, this zirconium stuff, but how can you ever get these crowns off? He said the way to take a crown off is the 4-4-4 rule. Get yourself 4 brand new diamonds, make 4 cuts, 1 with each diamond, for not more than a minute, or you're going to heat up the tooth too much. So you have 4 diamonds, 4 minutes, 4 cuts. After that, you got to crack the rest of the crown off. And that sounds like a lot of work and a lot of money to remove a crown if I can do it 2 minutes with a laser. So what can I remove with this erbium laser? I can remove porcelain veneers. I can remove solid monolithic zirconium crowns. I can take off bi-layered zirconium crowns like lava or prismatic. I can take off Emax, veneers and crowns, Empress crowns, and pretty much anything ceramic I can get off. The only ones I haven't been able to get off are cases where they already have a root canal in them. If the tendinosis has already drilled a hole through your ceramic crown, it won't come off then. And we'll talk about that later. That probably has some more to do with some photoacoustic effects that we have with laser. But pretty much any ceramic restoration we can remove using an erbium laser. Okay, here we go with veneers. I know I can take off veneers. This is a case I did 20 years ago. These are Empress. This guy is such a bruxer. You can see where he broke the veneer. Instead of breaking it at the top, he broke it at the gum line. That's how much he clenches and grinds. He has his night guard. But 20-year-old veneers, they don't look too bad. So now I have to take that one off. How am I going to take it off? I'm going to take the laser. I'm going to shine it on the veneer. It's going to break the cement seal with the left. And 2 minutes later, it pops off. You can see the veneer's gone and all the cement. So you can see there's no charring. There's no burning. Basically, I'm breaking the seal between the veneer and the cement. Thin veneer, easy to take off. Other erbium lasers can probably do this, probably, but I don't know if they can do it without burning or breaking the veneers. So here we go. So now this is one of my cases. This is one I just did. These were Emax veneers. The only trouble was I told the lab I wanted Empress. And I don't think they look as nice as the Empress does. The patient doesn't think they look as nice as the Empress does. So I took her case, I mailed it back to the lab and said, do them over, do them right, do them in Empress. So the patient, keep these on for 2 more weeks. When the new ones come on, I'll remove these and we'll put the new ones on. So this case, I'm saving myself time. I'm not cutting these off, taking new impressions, having new ones made, temporizing them, having the patient have to come back. After spending over an hour here now cutting these off and taking new impressions, it comes back 2 weeks later. I take off the veneers. You can see the veneers come off in one piece. These are Emax. No breaking. The cement's all still on the tooth. I take a 12-fluted finishing burr, take off the cement, try the new veneers on, cement them on, patient's on the road. Very simple, saves me a lot of time. And I just got a call from a dental school down in Florida. They just had a patient the other day that when their students put on veneers and these ceramic crowns, sometimes they don't put them on all the way. They don't go on quite straight. The instructor told me it took them 4 hours of extra time to get the crown off, cut it off, temporize it. She was like, can you come down and show my faculty how we can use lasers? I go, sure. It's going to save the university a lot of time to cut off these brand new crowns where there's nothing wrong with them, when you can take them off in one piece with the veneer and put it right back on. So how about bruxer crown? Now we're talking something different. Now we're talking a little bit more thickness. Here we got ceramic steel. Can I put a laser light through this and break the seal and not break the crown? This is a patient that I put a bruxer crown, solid zirconium on. I put the crown on. This was done about 4 years ago. And the patient goes, doesn't feel quite right when she came back for come after I put on. It doesn't feel right. So I adjusted the bite and I said, it'll be fine. Saw her in 6 months for cleaning. It still doesn't feel quite right. I did some more adjusting on the bite. Came back 6 months later, and you started looking, and that probably is at the apex there, a PAP. It's tooth necrotic. It needs a crown. It needs a root canal. To do the root canal, I said, Mary, tooth needs a root canal. But we can still leave the crown on. I'm going to drill a little hole through your crown. I'm going to clean everything out, do the root canal, put a little ceramic and restoration in there. Everything will be fine. Because you're going to drill a hole through my new crown. Well, that's fine, Mary. It'll feel good. If you don't like it, I'll cut it off and make you a whole new crown. And she gave me that look like, are you kidding? But Mary, I developed a technique, taking off the veneers, and I had removed one lava bridge, an anterior bridge that was an anterior bridge, which was, an anterior one, but pretty thin, but I was able to pop that off in one piece. So I go, let me try to see if we can do it on a lower one. I said, okay. So what I did was I numbed it up, so I'm going to do the root canal anyway. I took my laser with my fiber tip, trace it over the whole biting surface, trace it over the whole buccal surface. I'm tracing it over the lingual surface, and all of a sudden the crown pops off, and my dental assistant Tammy catches it in the high suction vacuum. We're using water on this, so we don't heat. She catches the crown. Look at the tooth. No burning. Everything looks great. Came off in one piece. All the cement's there. Do the root canal. Look at the crown. Crown looks wonderful. No cement in it. Just took a little air abrasion, clean the inside. Do the root canal. Put the crown back on. What was this able to do for me? I can remove the restorations in one piece. I don't damage the restorations. It's a lot quicker than cutting this thing off with diamond burrs. I think it's even quicker to do a root canal and drilling a hole through it and then having to put a composite in it. I don't have the cost of the diamonds or the burrs. There's no trauma to the underlying tooth. Do my root canal, put my crown back on. Mary's happy, I'm happy. This is a year later, and now this has actually been 4 years later. It hasn't been any destruction to the crown. The crown looks wonderful. We're good. Now, how often do you have to take off ceramic crowns? Depends where you are and who you are. This is another patient I had, same sort of thing. I did this solid zirconium crown, Bruxer crown, 13 months ago. It comes in, it's infected. That's the thing we're finding. We're doing crowns a lot of times because the tooth broke. This one had a broken cuff. That's probably what caused the tooth to die over time. So I want to take off this new crown, cut off, make a new one, drill a hole through it, do the root canal. No, I'm just going to take the crown off, do the root canal. Nice looking crown, looks good. The bleeding is from my injections. Took it off, comes off one piece. No damage to the crowns, no damage to the underlying tooth. Put it back on, send the patient on the road. Let the root canal heal the tooth, and we're ready to go. A very quick and simple way to do your root canal and not have to redo your crowns. This is one, it's the same sort of thing. Patient had some pain. This tooth is a very badly broken down tooth. This tooth has been restored with Miracle Mix, which is a glass ionomer that's highly filled with metal. And on this one, when you take it off, the crown did come off in 2 minutes like all the other ones do. But you can see where the cement stayed inside the crown. This has something to do with probably the amount of metal that was in the tooth. The same thing you'd probably find if you're doing crowns that have amalgam in them. And so, it's like I said, it doesn't matter where the cement goes. If it stays on the tooth, it comes in the crown. As long as we get off, air braid this, little sandblast, and put the crown back on after the root canal, and you're ready to go. So here it pretty much is. Tooth gives you troubles. You see it needs a root canal. Take off the crown, no damage to the crown. No damage to the tooth. And this one I isolated with rubber dams to show you. See how dry it looks and how the texture of cement looks funny. You know cement's on the crown. This is what the laser is doing. Somehow it's affecting the water content in the cement. It's breaking the cement down. It's got a sort of photoacoustic effect that it's going between the crown and the cement, bouncing in there. That's why it already has a root canal access. I don't think that's why they don't come off, because you don't have that bouncing around in that photoacoustic effect. It breaks it loose. You can see how frosty that looks. It comes off in one piece. Do the root canal, put it back on, you're ready to go. A year later, everything looks wonderful, and this has been 3 years, and everything looks great. So we can do Bruxer crown, solid zirconium. We've got a technique. Now, what happens if we're going to go to some of these layered crowns? Like this one, the first one I ever did was a lava crown, so I feel pretty good about taking off these layered zirconium and zirconium with the porcelain. They look prettier. They're usually thinner, but you still have to see, can you get the effect of your laser through these crowns. So this is a patient who comes in. These are porcelain and metal crowns. Can I take them off with a laser? No. There's no way you can go through metal. There's no way these metal crowns are going to come off. So I'm going to cut these crowns off. They're very short. I'm going to do some gingivectomies, make the gums look good, get rid of all that redness, take the impression the same day, make some nice lava crowns, put the crowns on, comes back a couple weeks later. They're nice and long, they look nice, the gums look awful. What's wrong here? I violated the biologic width. I should have done hard tissue crown lengthening instead of just soft tissue. Now I have to do that. Now I've got to take these crowns off, lay a flap, do hard tissue crown lengthening, and then remake these crowns. But the good thing about it is, what if I can take these crowns off, do my surgery, put these back on, bond them back on, because I always take them off, let everything heal. When everything's healed, I can go back and make new crowns. So I remove them, they come off in one piece. I don't break the crowns. Put the crowns back on, let everything heal up after my crown lengthening. And after everything heals, I make some new crowns. Everybody's happy, everything looks good. So these are nice temporaries because they're actually the actual lava crowns I use, and this is the final ones when I replaced them. Okay, here's another lava case. This is a case of, this is over a 10-year-old lava bridge. This patient's tough, he's missing a lot of teeth. This isn't his first bridge. He breaks everything. You can see the chips and the cracks and everything. And somehow he loosens the abutment on the premolar in the back. That's completely off. It goes up and down. But unfortunately, it's completely bonded on the canine. This is completely bonded here. This goes up and down. This tooth has a root canal. It's almost all composite. If I try to tap this off, I'm just going to break everything underneath it. But what if I can laser this, take off this unit, pop the whole thing off, either make him a new bridge, or in case if I smooth this up, he'd be happy, put his bridge back on, and he's back on the road. So let's laser this and remove that front abutment here. Take it off, comes off very simply. You can see this is the one that I lasered. See how it came off, it's all frosty. This is the one that had already come loose. You can see how that's all smooth. Laser, not laser. Either way, they're both off. You can see how much composite is on that canine. I didn't damage it at all. Got off in one piece. Cleaned it up, put the bridge back on, and he's happy. Did you want to cut off that anterior unit? Retemporize this, take a new impression, send off the lab, make him a new bridge, temporize that today. That can really mess up your morning. In this case, we're talking 2 minutes to get the bridge off, clean up, put it back on. Very, very little effect to my practice that morning. The patient's happy. Now this one looks kind of messy, this tooth. What's wrong with this one? This is a lava crown. Everything looks miserable around it. What's wrong here? Looks okay on the palate, but the crown looks nice, a beautiful crown. It's an implant tooth. This tooth has peri-implantitis. We've got terrible results. This is about a year-old implant. It's 10-millimeter pockets all the way around it. What are we going to do? So back to the surgeon. He wants to cut it out and do a new one. It's not even a year old. It has a nice crown on it. I'm a laser dentist. I said, I'll treat the peri-implantitis with my laser. But to get to it, how am I going to go around that tooth with my NDA fiber with that crown on? You can't. You got to remove the crown. Also, we want to get it out of bite, so hopefully it'll settle down. So what do? Take the crown off. Use my laser. Cement versus metal. The cement stays inside the crown. No problem. Clean that out with some air abrasion. In this case, I'm going to leave the crown off for a couple of weeks and just leave the abutment. It's a titanium, custom-made titanium abutment. Did my laser surgery. Let it sit like this for a couple of weeks, put the crown back on. I'm just going to wait a couple of years and hopefully, or maybe not a couple of years, but probably at least a year before I do any probing to see what kind of resolution and regeneration we're getting with my laser periodontal treatment. And we could say here, no damage taken off the crown, all the cement stayed inside the crown. Did my surgery and put the crown back on a couple of weeks afterwards. This is another case. This is an implant case. I put on, this is a basketball coach. She clenches and grinds and breaks everything. I put on this prismatic. It's what you see underneath is zirconium. It's porous on the outside, a fractured almost the week I put it in. Sent the impressions back to the lab and told them to make it solid zirconium. Just left this in. I get the new crown. She comes in. What do? Take it off with the laser. This is a gold UCLA type abutment. You can see same thing. Almost all the cement comes off in the crown. I'm throwing that crown away anyway. It doesn't matter. Clean this up. Try the new one on. Bond the solid zirconium. Ready to go. No problems. not creating any heat. Well, no problem to the implant. This was a healthy implant, and 4 years later, it's still a healthy implant. You can see I get the crown off in one piece, no burning, no charring. Got it off, threw it away, and put the new one on. These are Empress crowns. This patient had some ugly teeth. We made her nice Empress crowns. 10 years later, she comes in, and there's a crack running through here. And I need to remake these crowns. I'm going to remake both of them, so I got to take this off. Is that crack going to crack more when I take it off? Yeah, it's going to, but we're going to get them off in one piece. A lot quicker to take them off with the laser than all. Everything's strong underneath. Let's see if we can get that off. And like I said, that crack's going to crack, but once that's off, we'll re-prepare them, take a new impression, and then I'll just put some composite there after we re-cement these on to smooth it, leave it there for a couple of weeks. Laser again, pop off the crowns, and put the new ones on. Take them off. Everything's good for 10 years. I'm happy. Like I said, there's some chipping of the Empress, but came off pretty much one piece. Did my preps. Used my ND-YAG laser, so I wouldn't have to take any use any cord packing. Took the impressions. Put these back on, temporized them. A couple weeks later, put her new ones on. She's happy. Simple ways to use these crowns as temporaries for you. As Groucho told the young Marilyn Monroe, those are my principles. If you don't like them, I have others. I'm like Groucho. If you don't like these principles, I have others also. That's pretty much my presentation for today. What I want to bring to everyone's attention is there's different ways now to remove these ceramic crowns. Lasers are a great alternative, and like I said, I really, since I've been doing this, haven't had to cut off in a while. I have cut off lava bridges before, and that taught me really quickly that I wanted a different technique, and that's where this technique came from, for me having to cut off lava bridges. So today, be very aware of your patients. They know more about you than you know about them. They go on the web, they go on the internet, they read things, so be very aware. And definitely, we're going to go over some techniques now about where you can get lasers and answer any questions everybody has.
Dr. Kranska, there's a comment and a question here from one of our participants tonight that says, I've used this technique successfully for all ceramics as described, except for ceramic lava blocks. Hang on one second.
Mm-hmm.
And I'm trying to find the second part of that.
Because lava was the first ones I've ever done. And like I said, these were always processed, slab-made lava. Some of these were 10 years ago. Like I said, I only can take off what I need to take off, and that's one material I have never used, so I've really never tried to take one off. But the thing is, if you find, you read my articles. It was Dentistry Today, June 2013. Last month's Dentistry Today, March 2015. I have case studies. I have all my parameters step by step showing exactly what settings I use to take off what kind of crowns. And I do have some lavas in there that I've removed. Thing you can do is you can go for a little bit more power. Like some of these crowns I remove with 2 watts of power, and some I go up to 3, but I'm using very low power with, just letting that laser get in there and dry out the cement, using the photoacoustic effect to crack the cement loose.
So there's a question here, and I think you've addressed that by saying, where they're asking specific settings, and I believe in your articles you gave specific settings. Is that correct?
Yeah, I have parameters for every one of what I use to take off that crown. Like I said, there's at least 6 different types of crowns that I have in my articles and have all the parameters there using this laser.
So one thing is, are there different parameters for different types of materials?
No, I've used the same parameter for pretty much everything. Some of these metal implants I tried to cut down the hertz only using lower hertz. Because what happens on these lasers, what's nice about this Lightwalker laser is you can vary vary your power width. So what I'm using is I'm running a very short width. I want peak power. So I need a laser that can give me a peak power. I want the peak power, but I don't want a lot of power. I'm doing 2 watts or 3 watts. But then I also, the hertz, you can vary the hertz. Hertz is what hurts. And this is why it doesn't work on most erbium lasers. They only have like, it shoots so many times per second, it creates heat and it creates problems. With this Lightwalker, I'm able to use 8 hertz for 15 hertz, and by using these super low rates where it shoots off that high peak power and then it rests like 50,000 times and it shoots again, it does this every second. I don't get the heat, I don't get the burning. So basically for implants, sometimes I use 8, trying to get more time for it to cool and use a little more water on some. You'll see some of these cases I use more water, some I use less hertz so it doesn't heat, but I don't think it really makes any difference. Probably anything, as long as you're going under 15 hertz, it's not going to cause any problems. And somewhere around 3 watts is about what you need.
So another question is, any precautions for doing this with all ceramics cemented on zirconia implants, implant abutments?
That's the one thing I haven't been able to accomplish. I don't do that very often. I tried to remove a bridge the other day that had 2 zirconium abutments on it, and I can't get it to come off. So that's the one thing I haven't been able to figure out yet. And I don't know if I loosened it up by doing what I did, and I think I'm chickening out. It's a lava bridge that's got some chipping on the interior, on 2 interior teeth. And I think I'm going to chicken out and just take off the porcelain and make a porcelain veneer and bond the veneer onto the lava instead of trying to cut the thing off. But yeah, that's the one thing. That's the only thing I've had a failure on lately, is trying to figure out how to do zirconium on zirconium abutments. Somehow the laser can't figure out where it's supposed to be breaking it loose, it seems.
Interesting.
But like I said, it was on this bridge, so I mean, it might be different if it was a thinner and only a single crown. Fortunately, I don't do that many. Most of my implant abutments are titanium, and luckily I don't have to remove them very often.
A question here, I don't know if you have this, but it's asking if you have a video that shows the speed and motion of moving the handpiece while you're doing this.
No, I've never been videoed yet. That's something we can do, but I don't have the technology to do it. I've never done that yet. But what you do is you just basically, it's something that can take you less than 2 minutes. I start right at the gingival surface. It's shooting out water, like 4 to 2 usually, sometimes 6 to 2. You just trace it all the way across from mesial to distal, and go up distal to mesial. You just keep moving it, moving it, moving it, moving it, moving it, and by the time you're to the top, usually I do the occlusals first, then I do the buccals, then I do the linguals, then I pop them off with a little crown remover or with a sickle scaler, and they pop right off. Don't let the patient swallow. But it's something fairly quick. Time yourself, and like I said, it shouldn't take you more than a minute to do the whole thing with the laser, and then just pop it off.
The question that I think I started asking earlier, and I only got the part of it, says these Cerac lava crowns seem to absorb the laser energy and are damaged by the energy. Do you think the laser still helps break the cement bond even though the crown itself is damaged?
Well, a lot of these people who are taking these off are not using my settings. They're doing it with these R2s. They're using 5 watts of power and different things. So a lot of it's how it's done. I think if you use a low power and just use the photoacoustic effect and the drying effect, they'll pop right off. If you're using too much power and you're seeing sparks and you're seeing all of a sudden some people think more power is better, that's what's happening, I think, a lot of times. Cut your power down. Take a little more time, and I think they'll come off. I don't do that many Ceracs, so I can't really tell you that. But like I said, I haven't had a ceramic one that hasn't come off so far, and you can see where I did those veneers and they came off all right. But if it's thicker, it could be a problem. That's the thing. Anything under 2-3 millimeters, there seems to be no problem. Once you start getting thicker with onlays and things like that, it might be problems breaking this completely off with those settings.
there's, let's see, just a second here. Let me, maybe there's.
Yeah, as I said, everyone doing these, write down your parameters. Tell me what you use, what your powers are, what water, you're using it super short width, what size fibers you're using. It makes a difference. Like I've tried to use some real wide fibers, anything over a millimeter, like 1.2 millimeters. They seem like they damage the ceramic and they really don't take off the crowns, where usually the ones I use are 0.8 to 1 millimeter and they work great. So it could be your tips, it could be the amount of power. You need to write all this down, and when you have questions, be able to supply us more information. I can answer questions better if I know what you did.
Another quick question here. Could cement that stays inside the crown be removed from the inside of the crown with the erbium YAG laser?
I wouldn't. I guess it could, but anytime you have a zirconium crown, you need to clean it out with air abrasion anyway before you cement it. Once zirconium gets saliva on it, it needs to be cleaned properly, so you really need to, clean it out properly, and the air abrasion only takes 2 seconds. I guess you could try it with the laser. I don't know. I mean, why? It takes a lot of time and a lot of energy, where if the air abrasion takes 2 seconds and it's gone.
Let me see if there's...
Because you can buy these little handheld air abrasion units for just $159 from Denmat or different things, and they work very quickly and they're very easy. Hook them up to a little bit of in your lab to your compressor air source, and it cleans it out in seconds.
So you're doing most of this with the R or H14 handpiece, the tipped handpiece, as opposed to the R or H02, correct?
Yeah, the R02 can be used on veneers, but that'll probably break your veneer. Now I just used one with the fiber. That way I know that my focal point is just a millimeter off the tip. If I put that right on the ceramic, it's almost perfect. It's going in about a millimeter into the ceramic, and it's having enough penetration that it's breaking everything loose. If I did the O2, I'd have to be pretty good to be able to keep that exactly 7 millimeters away all the time when I'm moving. So just for logistics, it's very easy to know exactly where my power is going. And a lot of people who try to take them off using the O2 say they have troubles because I don't think they're able to keep the focal point and where the power is at exactly the same place when they're moving it around.
And one last question. It says, do you lose any glaze? Can you scratch the crown when removing with the laser?
The only time I have done that is when I've gone to a larger than a 1 millimeter fiber tip. I tried some 1.3. I was having trouble with breaking some fibers, so I went to a wider fiber, and it seemed like it was starting to take off the glaze. So I went back to the 800 millimeter ones, and they're fine. 0.8 millimeter ones, they're fine. And to be honest with you, I'm still using pretty much the same fiber. I just use it to remove crowns. I've been using it now for 3 years. I pretty much have that one same fiber that I use just to remove crowns. It doesn't break. It works fine. It doesn't do any damage for me. But when I tried to use larger ones to be more effective, it ended up doing a little bit of damage. But then you can buff it out and usually put it right back on.
I think you had this on your earlier slide where you were telling about your practice and that with your business card, but is there an email address where some of these people with specific questions or want to send you what they're using and et cetera that they can send to?
It's Family Laser Dentistry. All one word, Family Laser Dentistry at outlook.com.
Okay, great. I appreciate it. And that's the last of the questions that we had. And Dr. Kranska, thank you very much. I know it's getting late there on the East Coast, and we appreciate you taking your time and sharing your experience and expertise with us. So thank you very much. We appreciate it.
You're all very welcome. And like I said, I'm very easy to get hold of. Read those articles, look it up, go on Facebook, Facebook me at Family and Laser Dentistry. Ask any question, I'll get back to everybody.
Great. Thank you very much, and good night, everybody.
Night.